Hey everyone, welcome to the Center for Spine Care Mobility. I'm here with Chloe, my daughter, and we're talking a little bit about the shoulder today. So I recently did a blog on the shoulder and I put together a little bit of a self-assessment which helps you understand a little bit about where your pain might be coming from. The shoulder is a fairly complex joint. It consists of roughly 26 muscles, and it's different from your hip joint that has a ball and socket. The shoulder, the humerus, or the bone of your arm sits in a very shallow plate on the shoulder, and it's held mostly by muscles, tendons, and ligaments into your body. So when you assess the shoulder, it's a little bit more complex than the hip. The first thing we want to do when someone comes into our office and has shoulder pain, believe it or not, is to address the neck. So what we'd like to do is do general ranges of motion within the cervical spine and a couple of orthopedic tests to make sure that the shoulder pain is not coming from the neck, which is a fairly common issue. So the first thing we're going to do is bring your chin to your chest. Let me see you do that. Good. Now go all the way back, so that's flexion. Then we're going to go all the way into extension, go back to neutral. Now we're going to look to the right all the way. Good. Now look to the left all the way. Good. That's rotation. Now we're going to laterally flex like this. Good. And laterally flex to the other side. If any of those movements mimic shoulder pain, that'll help us indicate or give us an indication that the pain might actually be coming from the neck. One of the standard orthopedic tests we use here in this office is called maximum cervical compression. So Chloe, can you bring your head all the way back like this? Now bring it to the side. Good, and now back a little bit more, and then just push down a little bit on your head. So when we do this, a little bit more like this and like this, we're determining whether or not the nerve is being pinched by any type of either soft tissue structure or arthritic condition which might be irritating that nerve, causing something called shoulder pain or mimicking shoulder pain. Okay, let's go into a little bit of some of the things that are common ailments with regards to the shoulder. The first thing we can talk about is something called thoracic outlet syndrome. So that's when the nerves in the shoulder become irritated and cause a neurological or a numbing or a numbness type of feeling in your hands and your arms. So what I'd like you to do is I would like you to bring your arms to 90 degrees and your hands to 90 degrees and just clap your hands up and down. And you're going to do this for about a minute or two. And what we're going to do is, if you have thoracic outlet syndrome, you'll start to feel numbness and tingling and kind of prickliness into your fingers. That's an indication that you might have thoracic outlet syndrome. So it's 90 and 90, clap your hands. The next thing we're going to assess is something called the rotator cuff. So there are 4 muscles in your shoulder which make up the rotator cuff. There's the supraspinatus muscle, the muscle which lies above the spine of the scapula, the infraspinatus muscle, the muscle which lies below the spine of the scapula, the teres minor muscle, which is one of the muscles which help move your arm, and then the muscle which lies inside the scapula called your subscapularis. 4 muscles, okay? Supraspinatus, infraspinatus, teres minor, subscapularis. So one of the tests that we're going to do to determine whether or not you have a rotator cuff injury is called an empty can test. So you're going to bring your arms up like this. Let me see you do it. Now bring it out a little bit, Chloe. Now turn your thumbs down towards the floor. And what you're going to do is you're going to resist when I push. Resist. Good. Resist. Now if you're by yourself, you can take this hand and push against that arm. So let me see you do it. Good. Now the other side. Perfect. So what we're doing is flexion, a little bit of what we call abduction, and then you're going to turn those thumbs towards the ground, okay? Empty can test and push. Empty can test and push. The next test we're going to do, which tests the teres minor muscle and the subscapularis muscle, is external rotation. So like you're holding a gun, you're going to bring your arm to 90 degrees, get that elbow a little closer to your body. Good. And what you're going to do is you're going to push your hand out away from your body. And if there's any pain with this test, it's usually indicative of those 2 muscles, the teres minor and the subscapularis. Same thing here. Gun and push. Good. The next thing we're going to assess is whether or not you have any type of arthritis in your shoulder. Again, it's similar to the rotator cuff test. External rotation, all right, and then push against the hand, looking for any type of pain, generally within the shoulder area. So again, this is for both rotator cuff and whether or not you have any type of arthritis. You can also palpate your shoulder. If there's any pain with palpation, usually indicative of an arthritic condition. Arthritic conditions are a little more common in our elderly population. The next thing we're going to look at is the AC joint, or the acromioclavicular joint. So that's the joint where your clavicle, or this bone right here, comes and and enters into the shoulder region. So the clavicle reaches the acromion and the clavicle come together, your acromioclavicular joint. What you're going to do is you're going to take your arm, you're going to bring it across your chest, and you're going to pull a little bit. Now, if that squeezes the AC joint and causes pain, that's usually indicative of a problem with your acromioclavicular joint. The next thing you're going to do is take your hands together like this, and you're going to pull them apart hard. Try to really pull them apart. If there's any pain with this in the shoulder region, it could be indicative of your acromioclavicular joint. The sixth region we're going to check is just general bursitis in the shoulder. So what you're going to do is you're going to take your hand and you're going to put it right on your shoulder. If you feel any warmth or if you feel like it's swollen, you might want to do this with your shirt off. That's usually indicative of the bursa of the shoulder being inflamed, and that can occur from a couple different structures, either pushing on the bursa or just general inflammation within the bursa. The seventh structure we're going to test is impingement of the shoulder. So impingement usually occurs when your supraspinatus muscle impinges underneath the tendons of your shoulder. And this is a fairly common thing. It can lead to tendonitis within the rotator cuff. The first thing we're going to do is take your arm and bring it across your body and push a little bit, see if there's any kind of pain in that area. Good. The next thing you're going to do is you're going to take your hand, put it on the opposite shoulder, and you're going to lift your shoulder. If this elicits a pain response, you could have an impingement type of situation in your shoulder. The eighth test that we're going to do is something, we're going to test if there's any kind of inflammation of the tendons. So in order to do that, you're going to stand up, and you're going to take your arm, you're going to bring it away from your body and lift it as high as it can go. Okay? There's pain usually what we call in between 130 and 180 degrees of abduction. So towards the top of that motion, when you take your arm away from your body, you'll feel pain in that region. Again, tendonitis within that shoulder joint. Instability, if you have an old injury, an old sports injury, if you've fallen on your arm skiing, it can create an unstable surface. 90 and 90, like this, and then you're just going to externally rotate back a little bit. So you usually can use an assistant for this. Push here, I'm pushing back with this hand, I'm pushing this way on the back of the shoulder, and I'm looking for whether or not she feels any instability in this part of the shoulder. And then the last test, the 10th test, is just fibromyalgia. So what you're going to do is you're going to take your hand and you're going to feel around for trigger points in the back of the shoulder in a muscle called the trapezius. You're also going to notice whether or not your shoulder feels tired, like you have a dead arm, or whether or not the shoulder's kind of not working properly, or just feels tired and stiff all the time. So those are 10 basic kind of screen tests that you can do at home to kind of narrow down where your shoulder pain's coming from. And by no means do I want you to determine by yourself whether or not you have a specific shoulder injury, but you can use these as a screening tool, and this will help determine where your pain might be coming from. As always, it's important or appropriate to have a professional look at your shoulder to determine specifically where it's coming from. Here at the Center for Spine Care Mobility, we have chiropractors, physical therapists, acupuncturists, massage therapists, medical physicians, and nurse practitioners on staff, which help specify where your pain is coming from, and then collectively we put together a treatment program based on your patient's needs. I hope this helped. I hope this was a little bit of quality information to help you guys further assess what's going on with your shoulder. Thanks, and take care.
That was good. Second try.
Not bad, right?
Not bad.
Yeah.